Hi, my name is Shayna White and I am a nurse practitioner student at Auburn University. I'm going to be doing a comprehensive head-to-toe assessment on an adult male. For the purposes of this video, we are going to maintain modesty, so the patient's going to keep all of his clothes on and we will have to alternate some of our testing accordingly. In order to save time for the video, I'm also only going to be assessing one side of the body. I'm always going to be doing an inspection of the skin at every body part, and I have already washed my hands, introduced myself, and gotten vitals, height, weight, and a pain assessment. So we're going to start out by taking a look at the patient's head. I'm going to start with his scalp. I'm going to look at his hair distribution. He has soft, fine hair. We're going to be palpating around to feel for any lumps or masses, which I am not feeling. I'm not feeling anything. Okay. So overall, the face, we're assessing for symmetry, inspections, for any lesions, bruising, redness, etc. He does not have anything. So the skin is appropriate throughout the face. I'm going to palpate the sinuses. So this is the frontal and then the maxillary. Do you feel any pain or tenderness as I am palpating around?
No.
Okay. I'm also going to palpate the lacrimal gland. I do not feel. I'm going to be palpating around the outside of the ear, which I do not feel any abnormalities there either. So now I'm going to start out with the eye assessment. We would normally test for cranial nerve 2 visual acuity with a Snellen chart, but we do not have one. So I'll just explain that normally you would cover one eye, read to the lowest line, then cover the other eye, read to the lowest line, and then with both eyes open, read the lowest line, and then you would get your visual acuity. He does have corrective lenses on, so we would assume that his vision would be 20/20 if we had a chart. The rest of the cranial nerves for the eye are 3, 4, and 6, and we're going to test for them while we're doing the eye assessment. So I'm going to have you just look straight ahead at me. I would say that his pupils are graded probably about a 4. Can you cover one eye for me? Good. Uncover it for me? Good. So I did not notice any issues with the cover and uncover test. It was a normal finding. I'm going to assess for your extraocular eye movements. So I want you to follow my finger wherever it goes, keeping your head straight ahead. Good. So no nystagmus was noted. We're going to do the confrontation test. So or the static finger wiggle test. I'm going to have you cover up your eye, and I'm going to close my same one, and I'm going to come in from each side, and you tell me when you see my fingers wiggling.
See him. See him. See him.
Good. So that is, you go ahead and cover. That is appropriate as well. So I'm going to assess for his pupillary reaction as well, direct and consensual. So stare straight ahead at me. Good. So pupils were equal, round, reactive to light, and accommodating. I'm going to assess the inner eye. It's my right hand, the otoscope is in my, or ophthalmoscope is in my right hand. I'm assessing with my right eye into his right eye. We're going to be looking for the red light reflex and assessing his conjunctiva, his macula fovea, looking for the optic disc and all the inner, first with the outer eye and then moving into the inner eye. So I'm just going to look at the outside. And his conjunctiva is pink, his sclera is white. There's no excessive redness of the blood vessels, and I'm going to move closer in. Good. He had a positive red light reflex. There were no abnormalities of the inner eye. I'm going to do the cotton wisp test, so just stare straight ahead at me. Keep your eye open. Good. So that was appropriate as well. We'll go ahead and move down to the nose. So I'm going to assess for patency. Can you blow out for me? Good. We're going to take a look at the nose. So he does not have any excessive drainage or redness. His turbinates project into the septum. He has midline. So that is all normal finding as well. We're going to test cranial nerve 1. So I'm going to hold a smell underneath your nose. You let me know what you smell. Close your eyes for me. cranial nerve 1 is intact. So now we're going to test facial movements. This is going to test cranial nerve 5 and 7. So I'm going to palpate the temporomandibular joint, and I want you to open up your mouth real wide. Close it. All right, clench your jaw. Good. Now I want you to puff out your cheeks. Good. So now we'll move on to the ears. Once again, assessing to make sure they're midline. We already palpated the outside. We're going to take a look at the inside of the ear. Good. There's a little cerumen in there, but nothing excessive. There's no redness. I can see his tympanic membrane. It's pearly gray. The ear canal is pretty much clear. We're also going to test for cranial nerve 8, the auditory cranial nerve, with the Weber and Rhine test. Weber test tests for lateralization. The Rhine test tests for air and bone conduction. So I'm going to hold this in the middle of your head. You let me know if you hear it in one ear, both ears, one more so than the other, etc.
Both.
Both equally? Okay, so that's a normal Weber test. So we're going to use this again. I'm going to hold this on the back of your ear. You let me know when you stop feeling the vibration, and then I'm going to hold it over your ear, and you let me know when you stop hearing the vibration, okay?
No. No.
Good. So air conduction was longer than bone conduction, so that is a normal Rhine test as well. I'm also going to do the whisper test. So I'm going to close your ears on this side. I'm going to whisper something. You repeat back to me whatever I whisper, okay?
Apple, orange, banana.
Perfect. So the whisper test was appropriate as well. Now we're going to move down to the mouth. I'm looking at the lips. They appear to be moist and supple. I'm going to have you open up your mouth for me as I take a look inside. So I'm looking at the uvula. It is midline. He does not have any tonsils. It looks like they've probably been removed. Dentation looks good. He's got a retainer. No bleeding of the gums. I'm going to test your gag reflex. So that is appropriate as well. And then I want you to go ahead and do some tongue movements for me. So I'm going to have you stick at your tongue, lift it up, move it side to side. Perfect. So that tests for cranial nerve 9, 10, and 12. The last cranial nerve that we'll test for while we're going through them is the shoulder shrug test. So I'm going to hold my hands like this and shrug against it. Good. So that's appropriate. And I would rate his strength a 5 out of 5 as well. So now we're going to do some sensation tests. I'm going to put this on different areas of your face. You let me know if you feel sharp or dull, okay?
Dull. Sharp. Sharp. Dull.
Yeah. So that is appropriate as well. Moving down towards the neck, I'm looking to see if he has any jugular vein distension. We'll also check that whenever he's reclined back at a 45-degree angle as well. But I do not see any. I'll palpate the carotid, and I would grade it a 2+. I'm also going to listen to the carotid and the temporal artery with the bell of my scope. And no bruit was auscultated on either the carotid or the temporal artery. I'm going to feel for the lymph nodes now. So you let me know if you feel any pain or tenderness as I'm palpating around the different areas, okay? So we have the preauricular, postauricular, occipital, tonsillar, submaxillary, submental, anterior cervical, posterior cervical, and supraclavicular. Did you feel any pain or tenderness throughout there? Okay. No lymph nodes were palpated or palpable, so that is a normal finding. We'll do a couple range of motion things while we're kind of at the neck, so I'm going to have you put your head forward, rotate it back, and then go side to side, and then rotate all the way around. Good. So the cervical neck has full range of motion as well. You didn't feel any pain as you were doing any of that, correct? Okay. So I'm going to go ahead and move down the arm at this time while I'm up here. So I'm going to, we'll start out with some range of motion things first. So with the shoulder, I want you to lift your arm straight up, cross it over, and all the way out, and then kind of rotate around. Good. So he has full range of motion of his shoulder. For your elbow, I want you to lift up, extend out, and then kind of twist around. Good. Full range of motion of the elbow. For the wrist, I want you to go down, up, side, side, and rotate all around. Did you feel any pain at any of those joints?
No.
So he has full range of motion in his wrist as well. I do not see any swelling or edema of the arm. There is no lesions or wounds or bruising. I'm going to test capillary refill, which is less than 2 seconds. And I'm going to feel for the brachial pulse, which is a 2, and the radial pulse, which is also a 2. And then I'm going to feel for the epitrochlear nodes, which I do not feel as well. We'll also go ahead and do a breast exam really quick. I'm going to feel around in a circular motion without lifting my fingers up for any masses or nodes, and I do not feel any. And now I'm going to have you lift your arm up while I do it another time, feeling all the way around. I do not feel anything going through the tail of the spence into the axilla. I do not feel any nodes or masses, so that is an appropriate finding as well. So now we'll go ahead and do the anterior thorax. I'm going to start out by doing the respiratory assessment. So I'm going to have you say 99 as I go down assessing for tactile fremitus.
99, 99, 99.
Perfect. So no tactile fremitus. We'll go ahead and percuss. So resonant lung sounds were percussed throughout, no hyperresonance was noted. I'm going to go ahead and listen with my stethoscope as well for your lung feels. You can breathe for me. Lung sounds were clear. I did not hear any adventitious lung sounds throughout on both sides. So now we'll go ahead and do our cardiac assessment. So I'm going to be listening to the 5 cardiac points: aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm listening to them with my bell and my diaphragm. And I'm also going to feel in those same points for any pulsations. We're also going to assess for the point of maximal impact, or PMI, which is typically the third intercostal space, left sternal border is where it would be palpated if you could, but it's normal if you do not palpate it. So I'll start out by go ahead and palpating those points. I do not feel any lifts, heaves. I did not feel the point of maximal impact, but that's a normal finding as well. So I'll go ahead and listen with my stethoscope, those same cardiac points. No adventitious heart sounds were heard. S1 and S2 were heard, but did not hear any S3 or S4, which is a normal finding. So I'm going to go ahead and look at the back really quick. So we're going to assess the posterior thorax. Okay, so once again, starting with the respiratory assessment, I'm going to have you say 99 again.
99, 99, 99, 99.
Good. And then we're going to go ahead and percuss. Good. And once again, resonant lung sounds on percussion. I not hear any areas of dullness or hyperresonance. We're also going to go ahead and palpate and inspect the spine. I do not, we bend over just like a little bit. It does not look like he has any lateral curvature of the spine. It is normal, so no scoliosis. I'm going to assess for CVA tenderness while I'm back here, so I'm going to give a thud on each side of your back, and you let me know if you feel any tenderness over that part where you feel the thud, okay?
No. No.
Good. So no CVA tenderness, which is normal. We'll go ahead and assess for diaphragmatic excursion at this time as well. So I'm going to have you take a deep breath and hold it for me. Okay, go ahead and let it out. And then we're going to do the same thing, but I want you to take a deep breath and let it all out and hold it. You can breathe normally. Normal excursion is 3 to 5 centimeters, and he is about 3.5, so that is normal. I'm going to go ahead and auscultate. Did I auscultate? No, I need to auscultate still. So I'm going to auscultate the lung sounds in the back as well. So take a deep breath. Good. Let it out. Good. So clear lung sounds were heard throughout as well. So you can go ahead and, I'm going to assess for symmetry as well. So take a deep breath for me. About the 10th, yep, there you go. About the 10th rib is where you would see that. And it was symmetrical expansion. So now you can go ahead and go around to the other side.
Help me.
Yeah, like go sit on the bed for me again. Good. So now that we've seen the front and the back, I would say the A to P ratio is a 1 to 2, which is a normal finding as well. So I will go ahead and do the cardiac assessment again, but with you laying down at a 45-degree angle, so go ahead and lay back for me. This is a good time to once again assess for the carotid artery for any jugular vein distension. So go ahead and turn your head to the side, and I'll go ahead and palpate. I would say that's a 2 as well. I'm going to listen at those same 5 cardiac points while he's in a 45-degree angle too. So once again, S2 and S1 and S2 were heard, but no S3 or S4, so no adventitious cardiac sounds. It was regular rhythm. So we'll go ahead and move down to the abdomen. I'm going to lift up your shirt just a little bit. This part of the assessment is different in that we're going to, after inspection, auscultate first before I move on to percussion and palpation. So his umbilicus is midline. I do not see any obvious pulsation, so I'll go ahead and take a listen to the abdomen in all 4 quadrants. Bowel sounds were active in all 4 quadrants. While I have my stethoscope out, I'll go ahead and listen to the aortic, renal, and iliac arteries to assess for any bruit. And I did not hear any bruit over those arteries. Normally at this time we could go ahead and inspect or to palpate the femoral and artery and inguinal nodes, but because the patient is keeping his clothes on, we'll go ahead and skip that part of the assessment for right now. I'm going to percuss around the 4 quadrants. And I heard tympany in all 4 quadrants, which is normal. We'll also be percussing over for the spleen and the liver. dullness over the spleen. I'm going to assess for liver span. So normal liver span is 6 to 12 centimeters, and he is exactly 6. Okay, so I'll go ahead and, oh, we didn't palpate first, so I gotta do light palpation first. I'm gonna feel around you. Let me know if you feel any pain or tenderness anywhere. Do you feel any pain? I don't feel any masses here. And then deep palpation, we're going to be palpating for the organs. So I can't feel the spleen. Let me see if I can feel the liver. Go ahead and take a deep breath. Let it out. I couldn't palpate the liver as well, so that's a normal finding though. And then we'll go ahead and palpate around to the kidneys. Do you feel any pain or tenderness as I do that?
No.
Okay. So that is normal. Yeah, I can put your down, thank you. So now we'll go ahead and go to the lower extremities. I'm looking for the hair distribution, any swelling or edema, which he does not have. I'm gonna feel for the pulses. So the popliteal is a 2+. Posterior tibial, it's a 2+. And dorsalis pedis is a 2+. I'm also going to assess his capillary refill, which is less than 2 seconds, so that is normal. He does not have any clubbing of the toes and toenails, and no breaking of the nails as well. So while I have you laying down, I'm going to test for your Babinski reflex. Good, so that was negative, which is normal in an adult. We're also going to do a couple range of motion things while we're here. So we're going to do the hip, knee, and ankle while you're laying down. So go ahead and lift your leg up and then cross it over and all the way out. Good. And now I want you to take your knee and kind of put it towards your chest. Push it all the way out. Good. And then I want you to pull it this way. Good. And then the other way. Did you feel any pain or tenderness any there? Okay. And then with the ankle, I want you to push your foot down, pull it up, move it side to side, and then kind of roll it around. Perfect. So full range of motion there. We'll also test strength. So go ahead and push your feet against my hands. Pull back towards you. So that's a 5 out of 5 strength for that as well. I don't think that I assessed for your hand strength earlier, so we'll go ahead and do that. Will you give my hand a squeeze and pull against? Perfect. And then we're also going to do the heel to shin while you're here. So take your heel and rub it down your shin all the way down. Perfect. So that's normal. So cerebellar function is intact. You can go ahead and sit up. And we're going to go through some of the deep tendon reflexes now, starting with the arms and moving down to the legs. So we're going to start with relax your arm, just like that. I'm going to do the brachial. So that's a 2. And then we'll do the radial. And that's a 2. And then we're going to do relax your arm for me. There you go. Triceps. Good, that's a 2. And then we're going to do the patellar. It's a 2. And then the Achilles. Good, that's a 2 as well. So deep tendon reflexes are all intact. I'm going to give you a couple words for you to remember for the end of the assessment, and you need to repeat them back to me at the end. Remember the words lamp, key, banana. Okay? So go ahead and stand up for me. We're going to do a couple gait tests, so I want you just to walk normally that way. Good. Now when you walk back, I want you to walk heel to toe. Perfect. And then go ahead and turn around and walk on your tippy toes. Good. Now go ahead and come back here and stand in front of me. And then I want you to close your eyes, put your feet together, and hold your hand straight out. And hold it there for a couple seconds. Good, so that's a negative Romberg test, which is appropriate. I'm gonna have you do a couple range of motion things while you're standing as well. So we're assessing the spine. I want you to bend forward and bend back and then side to side. Good. Do you feel any pain as you were doing that? Okay. So go ahead and sit back down. We're gonna now test for stereognosis. So I'm gonna hand you an object and I want you to let me know what it is with your eyes closed, okay?
After the clip.
Yep. So that is intact as well. Can you repeat back these words to me? 1, 2, 18.
1 to 18.
Cool. And what was the words that I asked you to remember earlier?
Lamp, key, banana.
Perfect. Cerebellar function, once again, intact. So things that I think that I forgot to do throughout is that we didn't do pain and light touch for all of the extremities. So I'll go ahead and do that we'll start with your arms. Close your eyes and you let me know if you feel, close your eyes, and you let me know if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Dull.
Perfect. That's good. Also need to assess the thyroid. So your trachea was midline. I need you to take a sip of your water and I'm going to come around to the back and try to feel to see if your thyroid is palpable. No? Alright, so that is normal as well. I believe at this time that has finished my comprehensive assessment on an adult male.